you are all welcome. We are going to start because we are running out of time, and I see now it's 8 minutes after the time that we planned to start. And just to say that we are joined by our colleagues from all over the world. We have got one of the speakers, the president of FICE International, who is still trying to join. My name is Donald Ngonyama. I am the director at NACCW, and you are all welcome. I just want to acknowledge the following people. If they have not joined, they will join us as we proceed. I mentioned the president of FICE International, Dr. Anna Schmidt, and members coming from FICE International, as well as members of FICE Africa who are joining us. Professor Nixmeyer from the USA. We know Professor Nixmeyer has presented a number of webinars and will also be presenting a number of webinars in the KZN in the next coming weeks. And we've got child and youth care workers from our own country in South Africa, from child and youth care centers, from the NGOs, from government, from education, from justice, and you are all welcome. I also want to indicate that we've got a number of, we may be seeing 62 gadgets that have joined, but we have got people organized around the country who have joined in watch parties. And we encourage that if you are in watch parties, as you record your names, record everybody who is sitting with you. And if there is time for questions, please do so as well. Write down your questions that come from the members of the watch party too. I'm going to introduce our chairperson. I'm introducing the chairperson because she is new. As some of you will remember that we had our BGM last year on the 22nd of October, and we have always known Elwin Gallant as the chairperson of the NACCW. The new chairperson, for those who did not join that BGM, is Fiona Balgobind. Fiona holds qualifications in child and youth care work as well as in social work. And currently she is completing her master's in child and youth care through Durban University of Technology. She has been actively involved with the NACCW for many, many years. She was the National Association for Child and Youth Care Workers chairperson in KZN from 2017 to 2021, and also a deputy chairperson from a national deputy chairperson for the NACCW since 2017 to October last year when she was elected national chairperson. She's also serving on the KZN provincial task team, which is the lobbying and advocacy body for child and youth care centers in the province. Fiona, I would like to welcome you and also to thank you for your leadership since you came on board. I think you have also been compromising a lot of your time to make sure that the work of the association continues from where the former chairperson, Elwin Gallant, left off. And I hope that Elwin has joined as well. If he hasn't joined, he is going to join us as we proceed. And Elwin, good morning. Special greetings from myself if you have joined, and if not, we will pass the message to you. In the interest of time, I am not going to waste any more time, but to ask the national chairperson of the NACCW, Fiona Balgobind, to do some opening remarks, as well as a special introduction of our guest speaker. Fiona, I'm handing over to you. Thank you.
Thank you so much, Donald. Good morning, everybody, and special welcome to everyone. All protocol followed to our international, national, FICE Africa and international guests, and all our child and youth care workers and colleagues and partners working in the children's sector. I'm going to put my camera off as I take you through what I'm going to be doing before we get into our special guest speaker for this morning is take you through the South African context as we see it right now. So I'm going to share my presentation. So give me a minute and I'm going to put my camera off. But we look forward to deliberating on this discussion as our first discussion around this very, very important topic in the sector. Okay. Get into my slides. Can I just be guided by you, Donald, that you can see my slides?
Yes, but put it on slideshow.
Yes.
Okay, good morning, everybody, once again. What I'm going to be taking you through today is just the purpose of this webinar, and then I'm going to take you through the South African context. There is quite a bit in there, so bear with me and make your notes as you go along. So the purpose of today's webinar is just for us to, as NACCW, create some awareness on the global and international thinking on deinstitutionalizing CYCCs, and then to clarify the international context and debate around residential care, to share and to endorse the FICE International statement, and to encourage a proactive approach to deinstitutionalizing by agreeing on a suitable way forward at the end of today's webinar. So some important facts that we want to make sure we take conscious note of for today is that we are aware that there was a childcare reform summit that was recently held, and it was hosted by Hope and Homes for Children South Africa on the 12th and 13th November in Johannesburg, and it included government, civil society, and experts in the sector. However, our concern is that quite significant stakeholders, including NACCW, in the children's sector, were not invited to the summit, and thus we were not consulted with or included in the discussions or the outcomes that came out of the summit. Okay, I'm struggling to move to the next page. Malini, do you want to take over? It's not moving to the next page.
Yes, just give me a second.
I'll stop sharing. Right, you can put it on slideshow. Next slide. So back to the next one, sorry. So what has happened is that there is a concept notice that was created for the actual event that happened. And at the summit, this concept note was presented, obviously. The focus was on the rights-based, child-centered developmental agenda and focusing mainly on the rights of the child to stay in a family context. I don't think any of us can deny that that is the context we would love to see happen. So it should be highlighted that a child placed into residential care also has the same rights, but they also have no other option but to remain in some circumstances in residential care. And many of our children who are in residential care, we have to acknowledge, are happy to have this option rather than being left on the roads or being placed from one failed foster care placement to the next. Can move. Malini, next page. Okay, so there's a lot of reference that's made in the concept note, and it's important for us to understand in the South African context what has happened. So the concept note makes reference to a good few things that I'm going to point out quickly. It talks about evidence that they considered in this concept note as important and clear. However, what we found is that the research that is made reference to has no actual references attached, and it seems to be the same study that is repeated across all their supporting documents, which talks to their understanding of why residential care should be reconsidered. It is necessary for us to understand how many studies were actually reviewed over which periods, as it's important for us to ascertain the relevance to our current context of residential care, as they appear to have been informing the thinking. So why I say that is because this evidence has led to their statement, and this is the statement that has been put into that concept note. Children placed in institutions, irrespective of their access to basic services, grow poorly and fail to thrive because of the absence of nurturing care. Okay, so that's the statement that is in the concept note. They further make statements with no references in their concept note, stating that many continue to be placed in institutional rather than family-based alternative care where they do not receive minimally adequate nurturing care. So it's very important for us in the sector to cross-check the studies that we reviewed, to understand what evidence they are putting forward, and to have this evidence verified if it is being used to act as the underlying reasons for their intent to shut down institutional care. Next. They make reference to their reliance on government's commitment. As we know, in South Africa, we have the post-apartheid white paper on social development in 1997, and their concept note makes note of this because it obviously invests in strengthening families with support and needed services. But again, we say that we do need to review the system, and it should be reviewed, especially and measured properly to ascertain whether it has met its mandate, which is 30 years later. And we do know there are many flaws in the current system that need to be reviewed before we focus primarily on institutional care. So children should not be placed in orphanages and other institutions. That is what's there in this concept note. We question the use of the outdated terminology because in South Africa, we don't even use the terminology orphanages predominantly. And we say we are concerned if these are people that are actively involved in our sector, they are making decisions around residential care without proper consultation with those in residential care. And that is why we are sitting here this morning sharing with you around this topic to create further awareness on what's happening around us. We're acknowledging in this report that they themselves have acknowledged that South Africa is not on track to achieve global, regional, and national developmental goals, and they're referring to government's failure to establish a developmental child care and protection system. So as much as they're partnering with and want to partner with National Department of Social Development around the conversation of deinstitutionalizing, we are concerned that there's many things that are still wrong in the system that need to be refreshed and looked at. And then towards the end of the concept note, they make a final statement at the end. And this statement says that if government implements its commitment to operationalize a developmental childcare and protection system, then deinstitutionalization will follow. And this is repeatedly stated through their documents. For us, it's a question of why there has to be one option over the other, because South Africa has adopted a system that acknowledges that we offer a full continuum of care service to all our children in South Africa, and all options of care are equally important to meet all the diverse range of needs of our children that we experience. They have an expected outcome and impact in this report, and it's of concern for us because it clearly states the long-term target by 2030 is the closure of childcare institutions, reduced number of children placed in alternative care, and no further placements of children in institutional care. So this is what brings us to today morning's deliberations. The outcomes document. So as I said, there was a concept document and there is an outcomes document that came through. The outcomes document for the summit, as indicated, it was a partnership between Joburg, Gauteng, DSD, and Hope and Homes, who coordinated that summit. So there was an outcomes document. And again, it cites a lot of studies with no references. So we question its validity and its credibility in terms of coming together to make such conclusions. There's a shared vision that is stated in this outcomes document that by 2030, as indicated, they want to strengthen the developmental childcare protection system, which we don't disagree on, but at the same time, it will result in the elimination of institutional care. And that words is what we are concerned over, that particular comments. The key commitments that they put forward, the short-term outcomes by 2026, which is clearly put in this outcome document, is a moratorium on the placement of children under 3 in institutions, and by 2030, again, the elimination of institutional care. They make reference to only 10% of children in KZN CYCCs being reunified over a period of 2023-2024 in this report. And I think it's just important for us to highlight that firstly, they need to understand, and when I say they, I mean all stakeholders who have a different opinion, we all need to understand residential care in its current context and to understand the actual reasons why children are remaining in care and not being reunified, and get to the bottom of those factors and those reasonings first in order to come up with that conclusion. Then I'll take you through some news. So obviously there was a summit, there was a concept note, and there was a outcomes document that was put out. Many of us in the sector had not seen those documents between November, December, early January, and we're unaware of those documents that were put out and prepared and planned and discussed. And then many of us started to hear early January of things that were happening. So I'm going to share quickly news that was out and put out publicly for us to just be alert of what happened in the South African context. So in November on the 14th, there was the DST news, and they boldly had South Africa sets bold 2030 vision for transforming childcare and protection. And they made reference to the summit and the commitment to the 5-year care reform plan that they were putting together, which was aiming at fully transitioning away from institutional childcare. And of concern is that none of this feedback was cascaded, obviously, to the sector. And then in January, on the 14th, after we discovered that there had been these deliberations and there was an outcome from the summit, as the EXCO of NACCW, we did have a first meeting with CEO from Hope and Homes, which is Ashley. And we all know Ashley in the NACCW circle. But some of the key things that came out from that discussion was the reference around the long stays of children in residential care and some of the challenges linked to residential care, but their bigger focus being keeping children in families. And we agreed on the need for provincial consultations to take place on any of these debates. And at that point, we were informed that this intention had not been finalized and was still to be taken to the national structures. Next. So in December, there was an interesting article that was put out. I think we will share these articles on our media platforms for others to read up a bit more on this. So we had a response from Robin Foster from For the Voiceless, and it was first published on News 24. And hers was clear: plan to end institutions for children by 2030. Good intentions, but is it the wrong timing? And what she put clearly was there, the understanding that the context in which deinstitutionalization is being rolled out is essential to determine if its 2030 goal is in the best interest of children. And it's a very good article, so we'll recommend and we will put it out for sharing for others to read up on the South African welfare and social development context, which she puts very clearly into this article. But again, emphasizing why the need and why the rush to move towards such a process. Next. So obviously there was a question around which departments had bought into this concept and this idea and the summit that was held in Joburg around deinstitutionalizing institutional care. And so there was, on the 2nd of February, one statement that was put out by Western Cape Department of Social Development, clarifying their stance on care reform and child and youth care centers. So this is what came from that statement. We recognize that care in family setting is ideal and supports the least restrictive levels of care possible. However, in the Western Cape context, there is a growing need for child and youth care centers for children of all ages who cannot be placed with families for various reasons. And this includes children with severe disabilities as well as children with behavioral problems. The need is even greater in rural areas where families would have had to travel hundreds of kilometers to maintain contact with their children. And to address this demand in support of family reintegration, the department will open a new child and youth care center in Maritzburg next month. And this is coming from Western Cape Social Development. In order for the full implementation of non-institutional care to be realized, significant and sustained investment rather than lifting or shifting around existing resources will have to be made. So we have Western Cape's opinion and guidance around this matter. Next. There was also an article that went into the Times Live where on the 3rd of February, where the DA put out very clearly, they raised alarm about Gauteng's proposed plan to phase out children's homes, emphasizing that vulnerable youngsters could be put at risk. And they made very clear reference to this plan again that came out of the summit and the partnership that Social Development held with Hope and Homes. The department agreed to a major change to South Africa's child and youth care system, which is to end institutional care and move children into family-based care, such as foster care or reunification with relatives. And there would be an immediate ban on children under the age of 3 in children's homes. This would be followed by a gradual reduction in placements, leading to the closure of most CYCs by 2030. So as we can see, the same theme and same information coming out from different people who have put together documents to submit. In February again, so a lot of these information from the summit came forward towards the ending of January and February, and that's why it's quite hot news for us to be debating this morning. There was news from the children's homes in Gauteng, obviously being very clearly put out that children's homes in Gauteng will be closed by 2030. And then a statement that was made very openly why South Africa's challenges made care reform urgent and not optional. This is quite important to note as well, that they say in the statement, children are often removed from their families, not because they are unsafe, but because families lack access to support, disability services, income security, or early interventions. Now, we have a differing opinion, as this may have been the case maybe decades ago. However, if you look at the past 2 decades, increased cases of neglect, abandonment, and all forms of abuse, especially higher numbers of children being sexually abused, have been predominantly the reason for our removals and placements into residential care. And then it went on to say decades of local and global evidence has shown that institutional settings cannot provide the consistent, responsive caregiving children need to thrive, particularly in early childhood. Again, we have differing opinions that we wonder if this is recent, research, because the focus has shifted. In recent decades, we know the focus has moved to community care. And very limited focus was put in the last 2 decades or so around residential care. Please do mute yourself. Okay, so what we have emphasized is that in the last couple of decades in our country, there's been very little focus or attention placed on residential care. A lot of focus has been put on community care programs, and that also leads to the fact that we haven't had a lot of current research, which should have been reviewed to highlight what has happened in child and youth care centers in terms of transforming themselves and the type of programs that are currently being run to provide good quality childcare to children. Okay, and then to round it off, obviously the summit started in Gauteng with Gauteng DSD, and what is interesting is that Gauteng then came back on the 26th of February with their own statement, and they were part of the summit with Hope and Homes. So Gauteng's statement clarifies position on child and youth care centers, and this is what the Gauteng department has said. The department wishes to categorically clarify that there is no decision, policy, or plan to close CYCCs in Gauteng. Claims suggesting that Gauteng is moving to shut down CYCCs or abandon vulnerable children are incorrect and misleading. Gauteng participated in the 2025 Joburg Care Reform Summit as part of a long-standing partnership with civil society organizations, including Hope and Homes for Children, with the National Department of Social Development, leading on behalf of government. And they rounded off by saying that the following are important to know that comes out of their statement. The summit outcomes have not yet been endorsed by the national DSD. There is no binding policy decisions that have been imposed on provinces. Gauteng has not endorsed outcomes calling for widespread CYCC closures by 2030, which the department has explicitly stated are unrealistic within the current provincial context. The department wishes to clarify that there is no blanket ban on the admission of children under the age of 3 into CYCCs, and at no point will children be left without care, delayed in placement, or exposed to harm. So the department urges all stakeholders to refrain from unnecessary alarmism and to engage constructively as Gauteng continues to strengthen its child protection system. So this is where we're at, everyone, this morning, is that we've had the summit in November. We've had a concept note. We've had an outcome statement. We've had resolutions. Resolutions spoke around the closure of residential care, institutional care services by specific deadlines. And then we've seen both the state, Western Cape and Gauteng's statements publicly put out in taking their stand around this conversation. So with that, I hope you've made notes and you're noting our South African context. I now have the pleasure of moving forward, and I'm going to take you to the important part of this morning where we wanted to introduce our guest speaker and share with you his expertise around some of the global international perspectives as well around this topic. So I'm going to quickly introduce James Anglin to us and to everyone. He's not new to us. He's been very involved with NACCW, and he's been involved with NACCW and FICE South Africa since 1994. So very long-standing, strong relationship with NACCW. We must emphasize that James is not just anybody. He is a learned professor at the School of Child and Youth Care at the University of Victoria in Canada, and he's currently the president of FICE Canada and a research affiliate for residential care, childcare projects, which are in New York. And more importantly, because of his involvement and commitment to the South African context, he has been involved with NACCW over the years with the Interministerial Committee on Young People at Risk. Until the year 2000, he played a significant role as an advisor in the transformation of child and youth care systems. He's worked together with NACCW to look at a continuum of child and youth care options, which included residential and secure care facilities. He recognizes the value of residential, secure care, and other alternative care options, which all play an important role in that continuum of care spectrum. Although he has our international speaker for today, James knows and understands residential care, the reunification processes, foster care, and community care in South Africa through his engagements over the years with NACCW. He has attended I can't even say how many, but numerous NACCW conferences, offering presentations, being invited as our keynote speaker, and has visited many projects, programs, residential facilities in South Africa during his visits. And he has a very good understanding of our context and continues to extend his expertise and his support to NACCW. So we are looking forward and grateful to have him taking an interest and a commitment in understanding the current debate that's on our table and offering to support our process of sharing and creating awareness around this development. So we really do appreciate you, Jim, for coming forward, reaching out to NACCW and saying, let's start with some webinar, let's start with a conversation and take it forward so everybody becomes aware of what is happening in the sector. Can I ask everyone to please mute yourself? Good morning. Can I remind people to mute themselves?
Mute.
Thanks, Annie. Please, can you make sure you're staying muted as we hand over to James, and he's going to take us through his presentation. Thank you.
I don't know if I'm on yet, am I?
Yes, you are.
Okay. Well, good morning, South Africa. Let me just get my slides loaded up here. Just a second here. Doesn't want to share at the moment. Try again. It doesn't seem to be working, Melanie. I went through all the right steps.
It's
Oh, just a second.
fine,
Just
Professor.
there.
Yes.
Can you see it now?
Yes. Yes. Perfect.
Okay. Sorry, everyone, for that. These virtual realities are difficult for me to navigate sometimes. Well, first of all, I want to thank Melanie for setting all of this up and for the invitation from the NACCW. I also see, so good morning to South Africa, but also welcome to many international colleagues and friends. I notice the Secretary General of FICE Canada is on the line, and Larissa, thank you for joining. And Anna, I hope after I'm finished, you can add into anything that I forget or that should have been added in from the FICE statement. So we have a lot of expertise on the line today, and I'll try and do my presentation in enough time to allow for some discussion, because this is an important topic, as it's been said. I'm just going to give you a quick background in my own background. You got some of it in terms of South Africa, but I have for over 50 years been engaged with virtually all aspects of the child and youth care field. I began as a frontline worker in a mental health facility, so there were 3 cottages of 12 beds each, 12 children, and that was quite a learning experience. After that, I developed and directed a community-based group home for 6 young people, 6 adolescents. And this program was set up as a preventive program to try and help children reintegrate to their families before they had to go to a more intensive facility. I was also then, after that, involved in drafting residential program standards for the province of Ontario. Learned a great deal about quality care in that exercise, how difficult it is to define and to ensure. Then when I joined the University of Victoria, one of the first projects I had was researching the history of parent education and support. Having come from residential care, I said it would be a lot more effective if we could support parents to keep children at home. So I spent a number of years reviewing that and developing programs for parents. I also advise provinces on alternative care policy, quality assurance, and develop foster parent training curricula for one of the provinces. After a number of years, I had a chance to do a major research project, and I decided to take a look at residential group care. I entered this project being prepared to discover that actually what I was doing in residential care was not a good thing to do. And so I looked at 10 well-functioning programs that were considered well-functioning by people in the communities. And I then went in and spent time in each home at various parts of the day over a number of months, over 14 months, and actually found out that well-functioning residential care does exist, and it is very good for certain children at certain times in their lives. So I have published that in a book, which is available. And of course, I was lecturing and training child care workers for over 40 years. And I am now a research affiliate with Cornell University. They picked up some of my framework for what makes effective residential care, and they've now developed the CARE program, which is being implemented in I think hundreds of programs right now in 7 different countries around the world. So I think it's demonstrating that a principle-based approach to quality care can translate across cultures. And the last thing I'll mention is that I served as an expert witness over the last 5 years on several large class action lawsuits. So these were lawsuits brought by children who felt they were maltreated or abused in residential care. And so I guess in summary, what I'm saying is I've had a lot of experience with both quality residential care and also very poor quality residential care. So as I think has been said already, there is a global movement to replace all residential child care with family-based care. And it's often under the term deinstitutionalization. Also, there is a children's care reform being promoted by the Foreign Affairs Department in the UK. They have issued a global charter on children's care reform. So there are various terminologies that are being used. It's interesting to note that deinstitutionalization, I should slow down a little bit because I get long words mixed up. Deinstitutionalization has been around since at least the 1960s and 1970s. So when I entered the field in the 1970s, we were quite excited about getting children out of care who did not need to be in care. So deinstitutionalization didn't mean shutting all care down. It meant getting children out of care that was more intensive than what they needed, and to try and provide alternatives. So I've always had a view that alternative care has a very wide range of options, and the challenge is to match the options to the children. So South Africa is not alone in this, and the current debate is actually taking deinstitutionalization to its extreme. And I'll talk a little more about that as we go along. FICE International has promoted and advocated all forms of residential care for over 75 years. So very quickly, some of the key milestones in the history of FICE. And I know FICE South Africa is an important member of FICE International. It was founded in 1948 to primarily support quality residential care, what were then called children's communities. So it was a federation of people supporting children's communities to deal with the victims of World War II. And there was no other way to really deal with the masses of children who needed support and stability in their lives than to develop some form of children's community. In 1986, in response to some of the discussions around deinstitutionalization at that time, FICE published the Malmö Declaration, which reaffirmed its support for the role of quality residential care. Actually, I think I missed one here. In 1987, FICE was recognized by the United Nations as a global peace messenger for its advocacy work on behalf of children around the world. And then in 2007, the European Parliament launched the Quality for Children standards in support of all forms of alternative care. And FICE was a co-developer of these standards along with SOS and along with the International Federation of Foster Care Organizations. And lastly, currently, the FICE statement, and I believe you all received a copy of this with the announcement for this webinar. I really encourage you to read through that because I'm not going to go through it in its entirety. I'm going to try and highlight some of the points that I think we're trying to make in that document. And that came after several years of reviewing research and discussions across over 20 different nations. So I also want to say that I'm assuming that all of us, no matter what position we take in this debate, are intending to act in the best interests of children. And that's always challenging to get clarity and agreement on what's actually in the best interests of children. And there are a number of points on which I think we all agree, whether it's Hope and Homes or UNICEF or other groups who are advocating for the shutting down of residential care. I think we all agree that children deserve to live in safe, nurturing, and stable environments where they experience love and respect. And that is in the FICE statement. I think both sides also agree that children deserve to live in a family, preferably their family of origin or extended family. However, the reality is, as we all know, I think, that families of origin, as well as other forms of family-based care, are not always able to meet the needs of children with a variety of complex needs, even with support services. And there are many reasons for that, which we could get into later. I also assume that no one concerned with the care of children supports poor quality care, whatever the setting, whether it's in family of origin, kinship, foster, or staff group care. And I think this is really important to acknowledge. There have been serious problems in all of these areas. And none of us want to see that in any of the various sectors of alternative care or in families themselves. I think where we differ fundamentally is in the belief that staffed residential care settings can provide quality care. Many opponents of residential group care, and there are many organizations around the world, that believe that residential, and they usually use the term institutional, Hope and Homes uses the term institutional, is inherently harmful or damaging for children of all ages. And that's virtually a quote from a UNICEF report that I could give the reference to later. But without the time today to get into a detailed analysis, I refer you to the work of Professor Bruce Henderson. And at the end of this presentation, which I hope will be made available to all of you, there are a number of references that you could look at in terms of reviewing what the research actually says about the quality of residential care and whether or not it's inherently harmful. He reviewed over 500 relevant research studies and concluded that the research evidence does not support the conclusion that all residential care is inherently harmful for all children. What Henderson demonstrates is that what the research does show is that large, depersonalized, understaffed, and under-resourced environments, such as the infamous Romanian orphanages in the 1970s and 80s, are harmful for young children. And there's no question about that. However, what has happened is that this research, which is the Bucharest Early Intervention Project, does demonstrate that those institutions were harmful. But one cannot generalize from those very deprived environments with hundreds of children, with very few staff and resources. One cannot generalize those results to all forms of residential care that exist around the world. There are very few, if any, of those kinds of orphanages remaining, except in very, perhaps, very off the beat places. Henderson also points to growing evidence that quality residential care does help many young people to live in safe, nurturing, and stable environments. Residential care can be a very stable environment for children who've experienced multiple placements or perhaps lived in a very deprived environment and been very neglected for many years. And they can receive necessary developmental services and heal from painful and traumatic experiences. So that evidence is still building, but there are more and more studies coming out every year that demonstrate that quality residential care can make a positive difference. So it's important to understand that quality residential care is a support service for children and their families, and that good residential care practice strives to strengthen and support family relationships wherever possible. In preparation for this webinar, I was sent a copy of Module 1 of the report by Hope and Homes entitled Families, Not Institutions. Now, the word institutions is often used to refer to all forms of residential care, and I have some problems with that because the notion of an institution does not necessarily apply to many of the forms of out-of-home care that exist in this time. In other words, children don't become institutionalized in all forms of residential care simply because they live in group care. And there are many negative aspects to negative institutionalization, and I won't go into them all here, but I think what we have to do is to use a language that differentiates between traditional orphanages that very rarely exist anymore in most parts of the world, from larger developmental centers to community residences. These are very different kinds of programs, I should say. So what I'm suggesting is that quality residential care should not be understood in opposition to family or family-based care. I think that's a false dichotomy. Really, contemporary models of quality residential care, and I have looked at many, and I visited many around the world, they recognize and support that positive family relationships are important and that they're important to ensuring the success of reintegration following care. So we all know that children will eventually return either to their own families or to another family or to the community at large, and that good programs are trying to maintain whatever positive relationships and develop whatever positive relationships exist in the child's life. So when a child's own family is not safe or cannot meet the needs of a child, there is not always suitable kin or foster care available, and we know this from a lot of experience. As well, many young people prefer to live in a group care setting. As for them, any kinship or foster family setting is too intimate and trauma triggering, or feels like betraying their own family. And Fiona mentioned this already. That kind of feedback is also coming from young people in South Africa. And I'd like to just use a quote that came out of my own research study on residential care from one young person who I remember very well. And he said, you know, I have a family. I don't need another family. In a foster home, I am expected to fit in. Here in the group home, they work to fit in with me. And I think that underlines one of the differences between the nature of the environment of a foster family, which can be excellent for many young children, but not for all children. Many children much prefer to live in a group care setting, and I think we need to respect those voices. At the same time, we need to offer appropriate supports where families, kin, or foster parents are the most appropriate places for young people to be. No question about that. And FICE strongly supports the provision of all forms of care that best meet the needs of individual children. We need as diverse a spectrum of settings as possible. The fact is, each child is unique, and no one type of setting can meet the needs of every child. We need more options for children, rather than fewer. I really think if we're going to reduce the number of options in the community to meet the needs of children, the children are going to pay the price. The challenge is to ensure a quality living environment for each and every child. I don't think any of us would disagree with that. While it would be wonderful for every child to live and grow up in a family, the reality is we cannot ensure this for a great many children for a variety of reasons. Some of the reasons include a lack of available appropriate families, a scarcity of support resources, and the complex needs of many young people requiring more specialized kinds of care. It is a good idea and an important strategy to provide resources to strengthen families and to support kin and foster parents where appropriate. And FICE has issued a statement in support of quality kinship care. And also the statement on alternative care reinforces the need to have quality alternative care in all of its various forms. But until such a setting is available for a child, in other words, alternative to residential care, we must not remove a child from good residential care and place them in an unsafe, unwanted, or unstable environment. I am not aware of any jurisdiction that has successfully eliminated all of its residential care for young people, though some have tried. One that I experienced when I was doing a sabbatical in the United Kingdom, the county of Warwickshire shut down all of its group homes and all of its residential programs, and this was considered a great step forward by the people involved. However, when an evaluation was done, it came to light that what was happening was the very difficult children, the children who could not be cared for in foster care, were being sent to other counties to residential centers. So really, they didn't eliminate residential care, they just sent their children away for residential care. Australia, in a number of their provinces or states, tried to eliminate residential care. And some of them came fairly close, but then they realized they need to rebuild some of that system to meet the needs of children who cannot function well in other forms of alternative care. So, and perhaps the most recent example that we should look at is the United States. And they passed an act called the Family First Act. And so they really wanted to move their resources into prevention and to keep children in families, which is a good goal. None of us would disagree with that. However, over the past 6 to 7 years, they canceled funding for most residential care, and states are unable to fill the funding gap. And I know we have Nick Smyer on the line. I think he probably has direct experience of this in the United States. I have heard a number of administrators talking about what's happened and how difficult it is to manage the child welfare system without having enough quality residential care. So the result in the United States is that some young people are having to sleep in social workers' offices, in dormitories created in or attached to child welfare offices, or have become homeless. And I've seen pictures of some of these. They're just dormitories with bunks to store children because they have no alternatives for these young people. That is not quality care. And a number of states are being sued in court for neglecting the needs of children, and children are suffering greatly as a result of system neglect. So my point for South Africa would be none of us should wish this for South African children, to be treated in this inhumane manner, but I fear the trajectory is all too clear. If residential care is eliminated without the prior creation of other appropriate and quality alternative services, many children will suffer and unnecessarily suffer. Ensuring all children are safe, nurtured, and cared for in appropriate settings is highly complex. I certainly recognize that very well. And it is a challenging task for any society, and including South Africa. Each society and community has distinct strengths and challenges, and FICE recognizes that each country has to interpret and apply the Vienna Statement in a manner suitable to its own context. FICE is advocating for a nuanced and respectful conversation amongst all child welfare advocates and policymakers. So the point I'm trying to make and make clear, the debate about whether we should have residential care or not is not a closed issue. It's very much an open issue. And those who say it's been proven that all residences are bad for all children are simply wrong. The evidence does not support that. So we need a conversation that is informed by both relevant research evidence, and I think Fiona mentioned this very clearly. What evidence are we looking at? Does it apply? Does it generalize to the situations we're talking about? And also we need to draw on the practice experience of all those people who have worked with children for many, many years and develop good knowledge and skills about what it takes to provide quality services to young people. I also think we have to remember, and this is probably important in the context of the dialogue within South Africa today, the Vienna Statement says the participation of children and young people in decisions that affect them is fundamental. And this, of course, is in tune with the UN Convention on the Rights of the Child. Children and young people need to be meaningfully involved in all decisions that affect them, from placement to reintegration and from policy to practice. So we need to really hear from the voices of young people and not just cherry pick the people who've had bad experiences. And there are studies that present that kind of evidence, but there are other studies that present quite different evidence. So a careful review of the evidence, as Fiona said, is essential. So in summary, I want to make just a few points. None of us wants poor quality care in any setting. Secondly, credible research and practice evidence must guide our decisions, not ideology, not dogmatic statements. We must look at what the evidence of our experience and our research tells us. Thirdly, quality residential care has an important role to play in the spectrum of alternative care. I think that needs to be recognized. It may not need to be as large as it is in many countries, but I've never seen anybody get rid of all their residential care, and there are some good reasons for that. And lastly, this is a statement from a young person who lived both in an orphanage and in foster care. and she actually preferred her experience in the orphanage because it was more stable, and she felt that her needs were being better met. And that was obviously a good quality residential care institution. It's how children live that matters, not where children live. And if we keep that in mind, that may help guide us to make the best decisions for each and every child. So those are the references that I mentioned to Henderson's review of the research on residential care. What do we really know about residential care and its impact on children? Melanie, I'm sure, can get you copies of this if you want to follow up. And thank you for listening. Now, may we have a dialogue?
Thank you, Jim. I think that was a beautiful presentation, gives everyone a nice rounded understanding of exactly what's happening in the global international context. Before we move on to getting to our discussion and our questions and answers, I just want to move on the program and welcome our very other special guest, Dr. Anna Schmidt. And, she is the president of FICE International. They've led in many ways to this conversation as a leading body, coming forward with a statement very quickly around some of the concerns. And that statement is what was circulated to everybody. So this morning, we want to acknowledge and appreciate and welcome Anna joining us, Dr. Anna Schmidt. I'm just going to do a quick introduction of her and hand over to her for her to also take us through a little bit on her discussion linked to this conversation. So Dr. Anna Katerina Schmidt has served pro bono as our elected president of FICE International. She leads the collaboration at international level of its members, which are made up of national networks of organizations, which includes practitioners, researchers, policymakers, and care-experienced youth from more than 30 countries. Together, they work to improve quality across the entire spectrum of alternative care for children and youth, including foster care, various forms of group residential care, and the care of young people on the move. Dr. Schmidt holds a doctorate from the University of Zurich, Switzerland, and as a psychologist, she specializes in participatory quality development and empowerment in group and residential care. And in addition to extensive experience in both the private and nonprofit sectors, her professional perspective is further grounded in over 25 years of learning from the youth and practitioners in grassroots movements in Brazil and internationally. She advocates for differentiated, locally sensitive, and collaborative approaches centered on the specific needs, interests, strengths, and the potentials of each child, their family, and the community. So let us put our hands together to welcome and thank you, Anna, for making time to join us and be part of this important conversation. I hand over to you.
Thank you very much, dear Fiona, for those introductory words, and also to James for his presentation. Can you hear me all well?
Yes, we can.
Good, good. So I'm bringing you all the greetings of FICE International, of all our members. I'm very, very impressed by how many people are participating in this event today. I think that in itself is a very, very positive sign that there is interest, that there is engagement, that there is debate, that many different people bring in their experiences and their wisdom. That is very good to see. And I really must congratulate you on this event, especially because once more, NACCW, FICE South Africa, you all are pioneers. This is the first wider discussion that involves the FICE International Statement for Appropriate and Quality Alternative Care. So once more, you're not only discussing something very, very relevant to South Africa, but you will also be producing a lot of interesting and important impulses, which I and my other international colleagues who are here today will be only too happy to carry into our international discussions. I think there is little that I can add to the statements in addition to what James said. Like him, I would say, read it, think about it. It is really meant as a framework for conversations. I would like to focus briefly on the question of quality. Fiona mentioned reviewing the system. She mentioned decision makers. I think reviewing a system and speaking with all the different stakeholders and trying to ensure quality is always a process. We cannot imagine that somewhere out there is the miracle solution that fits everybody everywhere forever. And that's not the level we should be having discussions at. We should enter into these conversations. We should agree on our shared values, and you see a lot of those in in our statement. And then we should construct quality and what we mean by it together. In that context, my question always is, who are we talking about when we talk about quality requirements in alternative care, be it foster or residential or whatever the setting? And of course, it's always important to consider the possibilities and limits in the socio-economic, political context. All these conditions sometimes weigh quite heavy on us, but really, how can we maintain that focus on what the experience of the individual child is, of the individual family is, of what they need, of what they wish for, of what they can collaborate in? I advocate very much for understanding children and families and communities as resources also. They are not just objects that we do something to. So really, how can we maintain being centered around the child, being focused on the child, which is, I know that's something that the South African law also demands or states as a very important orientation. The other thing, what do we do with different opinions on the topic? James already presented how important it is to us also at FICE, how we recommend to enter into conversations also with those who have a different opinion. We are dealing with a complex matter in a complex context, and when something is complex, the more different perspectives you can look through at this topic help you to actually understand it better. FICE has always worked that way, sort of, we're all different, but together we are strong. The statement that we wrote is a perfect example of that. And I know that's an attitude which is quite central to South Africa's existence as well, to really profit from different ways of looking at the same topic, focus on the children, and also focus on those who have a lot of practical, direct experience with them. So I certainly would advocate on the point, from the point of view of FICE International, that you continue those conversations that will now already start in the discussion. That you are encouraged. You know, there are others out there discussing the questions, that we stay in contact, and that we focus on the many different ways in which quality in the different forms of care can be ensured. So I wish you all the best for those efforts. I look forward to the remainder of the discussions, and I continue to look forward to all the impulses coming out of South Africa to us internationally. Thank you very much.
Thank you so much, Anna. And I think we appreciate your comments and your feedback. And of course, we as NACCW South Africa are definitely endorsing what has been put forward as a statement, and even would like to look at what we're going to put forward as a local statement going forward as a South African response as well, which will be looked into coming and pending the outcome of our conversation today. So thank you, and we appreciate you being part of this conversation and hearing more and being guided more by the expertise of FICE International and all the other FICE bodies that are supporting this initiative and wanting to take it further. We appreciate the start of this conversation and your statement. Thank you for that. We're now going to move to the discussion. We try to leave extra time to allow people to share. I've already seen some extremely important conversations that are coming out in the messages. We've had Aten Kosi sharing a lot of information, very personal experience himself coming from living in residential care. And then we've had Conrad De Beer also putting in some comments, and Julie Todd from Pyramids Child Welfare, also a very strong advocate for child protection as well, putting some information. And I've also noticed Gert Jonker. He was one of the first persons who also, as an independent NGO consultant, who put forward a statement around deinstitutionalization and the dismantling of a world-class child protection system in December. And that alerted us to some of the conversation that had started around this topic. So I see them online. I'm not sure if they want to actually verbalize and speak to anything they've said. And then we can carry on with any further questions. And Donald and Zeni will also support me with this process. Julie, your hand is up. We can start with you.
Oops, if I can. Okay, am I unmuted?
Yes, we can hear you.
Yeah, perfect. Okay. Thank you for the presentations today. For those of you that don't know me, my name is Julie Todd. I'm a social worker in the child protection field for the last 40 years and have been a strong advocate for children's rights and worked on various advocacy groups in South Africa. So, James, I support all your comments made with regard to young people in care in your research and findings that you've had, because that has been my experience as well, working with young people. ISCAN Congress in 2012 in Ireland, young people that were in care there or had been in care reported the same comments that you came up with. Some of them fitted better in group homes, some in foster homes, some in families, but every child was different. One size doesn't fit all. And I think that the big thing for us is that we must keep the focus, the best interests of the child are paramount. In South Africa, unfortunately, we've repeatedly heard government officials promote deinstitutionalization because foster care is cheaper. And that's been said in many forums. It's not because it's in the best interest of the child, it's because it's a cheaper option. It cuts our budget. It saves us money. And the question also one must ask is that the success by those who advocate deinstitutionalization is based on the number of homes that they've actually closed. And I've heard that repeatedly said. Hope and Homes have said that. So what happened to these children who were returned in the communities? In South Africa, we've seen where some child and youth care centres have been closed for varying reasons. Children have ended up back in situations where they have been removed from or in worse situations. And it would be interesting to know if there's any follow-up studies on those children who have been so-called deinstitutionalized, returned to communities. What happened to those children? Is anybody following up and seeing where they are today? So for me, the whole focus should be more on reunification. The UNCRC has repeatedly told governments in South Africa that there's not enough emphasis on reunification. There are no kind of roll out of strong programs of reunification. We did develop a reunification training program, myself and Cindy, the Children in Distress Network, which we did moot and promote to government just before COVID. I think that the emphasis should be around reunification rather than deinstitutionalization and closing facilities. Bearing in mind, again, at all times, children should be consulted in matters that affect them, and the best interests of the children are paramount at all times. Thank you again for your presentations. It's a wonderful discussion, and there's lots of great comments in the chat.
Great. Thank you, Julie, for your feedback. Julie, I think even you could share slightly around the adoption side of it, because we're talking about family care and getting children back in there, and you've got very intensive, expertise and guidance on that adoption feedback as well.
Okay, I'm back again. Yes,
Just a quick comment.
Yeah, in terms of adoption, adoption in South Africa is a long, drawn-out process. There's a lot of obstacles put in the way for people actually adopting, even though verbally governments say they encourage it. I think that's, one of the things that we need to be looking at is the whole process within South Africa, the adoption process, how it's affected, the policies and practice around that, because there are a number of children that should be placed in and could be placed in adoption, but end up in care for a long periods of time. This is small children, and they shouldn't be. So there's a lot of room for improvements, and I think that, going back to your initial comment, Fiona, in terms of setting the context within the South African situation, is that often the right people are not consulted. So when it comes to this roundtable discussion about deinstitutionalization, NACCW is the most crucial organization in the country that should have been part of those discussions. Similarly, when we talk about with adoption matters or changing in policy in that regard, those that are directly involved in the service delivery, who have good track records, should be involved in those processes, but they aren't. They aren't involved in those consultations, and that's sorely lacking. And decisions are often made at the top without any consultation, direct consultation with those that are directly working on the ground. So the numbers of adoptions in the country are very limited. And there should be, whilst we encourage reintegration within the biological family and we work with that, it's not always possible. And there is the notion that biological and blood family also is better than non-related. And that also has to change within the South African context, because, again, one size doesn't fit all. If we can work with the biological family and the extended family, we will do so. But it's not the preferred option if it's not in the best interest of the child. And that should always be the guiding principle. And that's, and that isn't always the case.
Thanks,
Thanks,
Julie.
Fiona.
I see a hand up, Portia. You can unmute. Portia, you can unmute. Okay, can I open the floor while we're waiting? Okay, Conrad, we'll take your comment first.
Thank you for this wonderful webinar, and also congratulations to the NACCW for initiating it, and for all the speakers. Very important topics. I just want to emphasize that in this discussions, in the South African context as well as internationally, we need to strongly advocate for redefining what we understand by deinstitutionalization. Because deinstitutionalization, and particularly if one focus on those things that lead to poor quality care, are those institutional practices, those laws, systems, structures, and routines that intentionally or unintentionally fragment and undermine the vital quality connections, relationships, and bonds children or young people depend on across families, across whatever care settings, whether kinship, foster, or residential care and other community care context. And we must also start to focus on exactly what Tracy also referred to, on what is needed to improve quality care. And that is investing and strengthening child and youth care workers, caregivers, to improve also practices and the work and the care that they provide to, quality care provide to children and young people, but also to support the services across all care settings that are required to ensure quality care to children and young people we work with. And those are the things we need to focus on. And one can, of course, add to that list, but I just want to emphasize that as well. Thank you.
Great. Thank you. Looking for some. Aten Kosi, your hands up.
Am I audible?
Yes, we can hear you.
Okay. Okay, I'm pretty occupied trying to multitask, but I'm here for the conversation. First of all, thank you for the platform being given, especially to the speakers. I am partially mostly captured by most of the speakers, but I thought I would rather want to bring a case study of my story and why I think it is essential that we need to discuss this matter at a broader spectrum, especially on the emphasis of that speaker where she said there has to be consultation of young people. As somebody who grew up in an orphanage home from the age of 11, by the time when I was in an area where I had to move from the area because of the circumstances that I was facing, and my mother being informed that she was not fit enough to take care of us, I happened to stay in an orphanage home called Azra 58 in East London. My sisters, but here's the interesting part. A life has happened, obviously, in the orphanage homes. I've faced other issues, but what I can tell you is that I have witnessed that people that are coming from foster are not really achieving much as compared to people that are coming to orphanage homes. Because within foster, you are being trapped because you don't really get chances of being surrounded by other people and really learn on the lived experiences. This is exactly what I was able to gain within the children's home where I stayed. And I want to say this, that at some point, some children's homes, I would say open, they are giving opportunities, like where you are able to have extracurricular activities and some programs that are seeking to assist in development of children and youth. And in foster, you do not have much access into that, to be honest with you. You do not have much access into that. I am speaking on a very practical experience when it comes to myself and my sisters. My sisters are currently now doing, the other one is the first year, the other one is doing grade 11. But I can tell you within their experience, the other one is already studying further. But I can tell you that when you talk about my experience at the orphanage home, I will tell you that through the orphanage home, I was able to join organizations such as the National Association of Child Care Workers, which has allowed me to further enhance my skills of leadership, my skills of communication, my skills of civic engagement, that I am where I am because of being in orphanage homes. I know that you say being a foster, it's an alternative at its best, but we need to understand that some case scenarios are not the same. We cannot be put under one umbrella. We cannot be we cannot be put into one umbrella. We need to be given a choice, an alternative of saying this is the choice that a child wants. Remember, the Act of 2005, Section 38, it talks about a child having a choice. And I feel like this told that they're going to be closing their orphanage homes. It's much problematic because now young people, the youth, the children won't be given choices and don't have chances that I have had. I wish I could end up with more, but unfortunately, I'm also occupied with something, but I'm trying to balance everything. But overall, in essence, there has to be choices for young people. It has been very long in South Africa that our young people are not being heard enough. And when you are saying that you are closing these children's homes, you are taking their institutional rights and right to association. I cannot be forced to stay with the family that I want to stay. I am not happy with how my other peers have turned out to be after they went back to their circumstances. I am not saying my story is perfect, but because of I had to understand that life is not the same within the children's home and outside. But most of my peers are now facing socio-economic issues, teenage pregnancy, prostitution, substance abuse, and many other issues. It is because of when you are being taken from. It is because of when you are in communities. Sometimes it is not safe. It won't even be much safer when you are staying with a foster care because you are still being surrounded by community issues which will affect you. Thank you.
Thank you so much, Nkosi. I see you do hold some important roles as South African rep for International Care Leaver Council. So you are talking from, the perspective of care leavers and how important a voice is when we are looking at children's rights and taking this matter forward. I'm looking to see if there's any hands, but I'm also going to hand to, okay, we've got a hand. I'm going to take that one and then I'm going to hand over to Zeni, maybe to also, just that hand gone? Let me see quickly. Then maybe I'll just hand to Zeni if you want to go through any comments in the message box or highlight anything.
Thank you. Yes, thank you. I think there's some very interesting comments from a variety of people, and I wish they would speak to it because I think their voices would share it more articulately than I can just reading their comment. But Martin, for example, from CYCnet is here with us. We are very grateful for his presence. And he says that he can assure us that many experts in most, if not all European countries do not agree with UNICEF declaration also. Many reasons for that is the fact that the research-wise, where it stands is on very wobbly feet. And I think that's been coming out right through the issue of where is contemporary evidence that residential care is not speaking. And I think we've heard from Nkosi, and there is another speaker I'm trying to get to her, who also raises the fact that she has her testimony on how residential care was positive for her. And I know there are many such stories. Martin also said there's a recurring theme throughout many of these discussions. How do we define family and what constitutes a family? Have we not moved from a rather retro notion that family is a mother and a father and a couple of kids living in a 3-bedroomed home? Having grown up in care, I consider my family to be the other 64 boys in the children's home who are not my blood relatives. Something else that worries me deeply is what appears to be what I call the Eurification of South Africans' policy on looked after kids, because UNICEF declares all residential care ended in Europe by 2030. How can that notion simply be transferred to South Africa, a country with so many fundamentally different economic and social differences to Europe? So that was actually another comment. I see Anna has put on her camera. Maybe we'll hear her comments on these while I find a few other comments, Fiona.
Okay, great. Anna, you want to add?
Well, it was actually me who pointed out in reply to Martin that it's not like everybody in Europe agrees with the UNICEF statement or demand for a number of reasons. What is realistic, and also how in Europe we have a lot of diverse systems and experiences as well. Earlier on, somebody referred to the orphanages in Romania during Ceausescu's time, but that's not Romania now, and it's not the entirety of Europe, certainly, which I feel the UNICEF report has actually picked up as its reference. So there are many different systems there, and like everywhere else, we still need residential care, different forms of residential care, as one of several options, including foster care and so on. I myself am in Switzerland, and I recently visited a youth home that I work with. The youth there are there due to school social challenges, some of them due to having been in conflict with the law. And I arrived there at 5 in the afternoon, and the youth were coming back from their apprenticeships and their schools, and they sort of zoomed in and out of the building. One of them came running in and said, "Oh, I'll just leave my things here, then I'll go and visit my family." So we don't have these very closed systems that many of these recommendations talk about at all. It's quite normal for young people maybe to, if they have family nearby, to maybe sleep in a youth home 3 nights a week. 2 nights a week they sleep at their families. And on the weekend, maybe they even have a host weekend family where they go and stay. So many different things are possible that we should look at and consider. So that's just what I wanted to add on.
Thank you, Anna. I'm sorry, I was looking for Jim. I think he's sorry,
there?
Nick. I'm not sure if Nick is still on.
I saw Nick was present.
Is he still present? Would he like to comment as well? Just looking through quickly. Nick, yes, you can unmute. We would love to hear from you as well.
Maybe while Nick is getting ready. Oh, is he here? All right.
Hi.
Okay.
Sorry. Yeah.
Good
I was
morning.
just writing a comment that one of my interests has been policy practice over the years. And it's good policy practice to examine the underlying basic assumptions that are being made, both in terms of the problem as it exists and the proposed solution. The basic assumption of the child care reform people seems to be all institutions are bad, therefore we should get rid of all of them.
Mm.
However, I'm not sure what their assumption is about families, that all families are good. And I'm looking at we have 130 people online right now, and I would bet that every single one of us has had experience with bad institutions and bad families. So the answer isn't a 100% move in either direction. It's a consideration using the principle of the best interest of the child and the availability of the kinds of services. I've been in the child care work field for 60 years, and I've seen, I remember deinstitutionalization in the United States in the 1960s, when literally the state hospitals were dumping people literally onto the streets, not into other placements, onto the streets. And it was to save money. So I question what the motivation might be for this child care reform movement. I'm sure that there are people with very good intentions, but I think that behind it, there may be some other factors that are driving this. We have to be politically smart about this and realize that not everyone has the best intentions in the world. And in our policy struggle, we're going to have to, as Jim said, we're going to have to be able to provide really clear research. But those of us who work in policy know that research is great, but it doesn't convince a lot of policymakers, unfortunately. And so I hope that in this struggle, we're going to be smart enough about policy practice to realize what we have to do to put a stop to this kind of movement. So
Yes.
that's my comment.
Yeah.
Thank you, Nick.
Yeah, and Fiona, I think one comment in the chat box maybe is relevant to what Nick has been saying as well. Mr. Jonker talks about that the South African government is establishing a welfare state. It is clear, for example, if one consider the billions paid as social grants monthly, government is marginalizing civil society and centralizing power in the hands of government departments. In Gauteng, the Premier made this clear in government's policy very clearly in 2004 already. This current debate is but another example of the welfare state being entrenched. And I think that as NACCW, the thinking behind some of these movements and the deeper political background needs to be explored more fully, so we don't actually respond to it just at a superficial level. And I think that links to Nick's point about policy, practice, but what is, where's it all coming from? There are a few other comments I'd like to raise to read out, but you'll guide if there are any hands up first. Fiona?
There's no hands at the moment, so continue.
I think that Mandy Goebel from KZN is also saying that the family preservation model, as introduced to South Africa in the early 2000s, sort of covers family reunification and training, and was available and successful pilot run. Unfortunately, it required resources and goodwill from those holding authority, and funding was not made available. So I think the point being made here is that in the transformation of the child and youth care system, there were many pilots demonstrating a commitment from the child and youth care sector, many of them actually led by NACCW, I might say, that was demonstrating that a continuum of care was what we were committed to, including the fact that residential care was one of the alternatives. So I think that point is an important point to hold. And Andiswe has actually also talked about her experience as a young person growing up in a child and youth care center and how that has been beneficial to her. A Child Welfare Society is talking about South Africa facing a challenge in balancing expectations regarding the balance between compliance, governance, and service in relation to the best interests of the child. So we've heard the comment of best interests of the child quite a few times, but I think this is an interesting angle, is that how do we balance compliance, governance, and service delivery in quality care options. Elwyn Gallant, our previous chairperson, also makes an important point about government's reduced funding of private and state child and youth care centers has a direct influence on the quality of care for our children. So the funding issue, which is a critical issue, is also coming up. We will experience the mushrooming of unregistered child and youth care centers if we start closing existing child and youth care centers. The best interests of the children will be at risk. So I think that's also a valid point. We've had that history that we've actually managed to sort out in South Africa, and it's going to be raised again. And again, evidence-based data to be strengthened. I'm not too sure if there are any other hands before I give another last comment or two.
Yes, there's one more hand, so we can let you, Jabulile.
Yes, good morning, colleagues.
Morning.
I just received a message from the young person, Annelisi, where she has requested that I read her story. So her story reads as follows. Good morning, everyone. My name is Annelisi Madabana from Port Elizabeth. I am one of those children that grew up in an institution. I was rescued at the age of 6 years. I was removed from my family because of abuse from sexual to physical abuse. I was also near to death experience where I got burnt, in which I was hospitalized for more than 5 months. My case and my sister together was reported to the nearest child care office in Grahamstown, where I was born. We were then taken to a place of safety in Grahamstown. Then later we were moved to a Protea Child and Youth Care Center in PE. We didn't stay very long there. We were then moved to SOS Children's Village, Port Elizabeth. That's where I found a loving mother that raised me to who I am today. This topic today is very close to my heart because I stand and because I can stand and say I truly benefited from the institution. My experience was never easy from moving from one place to another, but I was raised with love, and most of all, I was raised with opportunity to be whoever I wanted to be. So I don't understand why they would close institution, because they have a they're very beneficial, not just to the child, but also think for the extended family as well. My only concern is the external social worker that really failed the children in the institution. I feel like as long as the child is placed, they do not care what happens after that. I also worked as a child and youth care worker for 4 years, and the struggle was the external social worker not doing their part with the help the children. It was a struggle even getting in contact with them. I feel with this topic, it will be right to say they can close down those instructions. They can close those instructions are not for the benefit of the children. I really do hope after this webinar, social development steps up and helps the institution and the children at large. Thank you very much. Thank you.
Thank you, Jabu, for reading that. And thank you, Andiswe, for acknowledging and sharing your story. I think more of those stories are so important to capture the essence of children that have experienced residential care and the benefit of it. And yes, your message is very clear to the policymakers and those who are decision makers to take a lot of this into account. I'm not seeing any more hands at the moment. Not sure if anyone else does want to still raise something loudly, and they can still put their hand up. But I'll just, okay, there is someone. Portia, you want to try again? Unmute yourself. Great.
Oh, thank you so much. Am I true?
We can hear you.
So thank you so much. I really appreciate the presentation and the feedback. My name is Portia. I'm from Kids Heaven Child and Youth Care Center in Benoni. What I actually wanted to raise, Julie has covered me, but I would like just to add to say the Department of Social Development should focus not on the institutions per se. There's a lot that is going on in schools. They should be proactive by deploying more child care workers in school to deal with the matters. The children, they are still going through a lot while they are focusing on the children that are being taken care of. There are children that are still in need out there, for example, in schools and primary schools. Thank you so much.
Thank you, Portia. Hey, yeah. We are going to be rounding up, so if there are any other hands, you're most welcome to share. I'm going to hand back to Zeni if there's anything else you want to point out from the messages. If not, then we're going to just move to program.
There are some important points that I could read out. Again, a point is that one of the key questions to pose to international advocacy organizations is residential care.
I think it was the supervisor of Chanduko who called. Yes, it was the supervisor of the field case manager. Yes.
Can I remind you all to mute yourselves so that we can hear Zeni?
Okay.
Thanks.
So international advocacy, this is a point that's being raised. Have residential care down in your own countries? Is there currently currently no country in the world residential care been entirely eliminated as a care option? So the point comes into the international debates. There's another point from China that government quality assurance and supervision is mostly staffed by human resources with minimum experience in child and youth care work. For example, district coordinator workers whose focus become structural monitoring instead of quality service to children and the life space experiences of children and youth. This raises the point, Fiona, we need to show what the care experiences space work have been for the same time. The bigger point here is that we do need to look at how do we assess quality care, and that needs to be, I think, considered. I just want to mention that yes, Nick Smyer says good policy practice.
Jenny, we are losing you. Your voice is dragging, so we're not hearing you so clear. Try again.
Nation of the problem kills. See, oh, sorry, I lost that. Sorry.
Okay, we can hear you now.
Dr. Shaw. Okay, I can hear you now. I think there's a comment here that join the conversation, find your provincial lobby movement and actively engage your voice matters. I'm just struggling to get back to that comment, but maybe Donald could read it because my screen is not moving quickly forward.
Okay,
but I think we've captured most of the comments.
Yes. The one that you just read,
Fiona.
Can you carry on? Yeah.
Yes.
Continue.
Yes, I think what I was saying is that there are many very valid comments made by a variety of people that have participated. And I think that we must make sure that we collate all these in a document that we can use to actually work towards the way forward for ourselves. And if Donald, if you can move and add any other comment if it's necessary, but I think that we've covered a lot of comments and maybe Jim would like to make any further input on what he's heard, and I would like to make another comment at a later stage. But Donald, over to you. Is there anything? I'm just not moving my screen at the moment. I'm just not too sure why.
I think a lot have been covered, and I agree that we will need to collate this into a document to help us as we move forward. Thank you.
I see one here now from Mandy that says government looks for residential facilities that tick compliance boxes. They don't understand or recognize quality services in terms of the child's lived experience. And that's where the focus of ongoing contemporary research needs to focus. And maybe we can turn to Anna and Jim and even Nick and the international people to see whether there can be some support for South Africa for some good research on quality practice. I think we've been struggling with funding for research, but I think that we would be open to partnering broadly with others. Nick Smyer's got his hand up, Fiona.
Yes. Okay, we can move to Nick. Thank you.
Well, we're dealing with a policy issue, and this is really going to be, the child care reform people sound like they have a strong case, and they really don't. The way to challenge policy really is good, hard questioning. So we have to have some good critical thinking going on here. The research is good. It's there. We can bring it up. But I'm telling you, and Jim probably won't like me saying this, but research doesn't matter a whole lot to some policymakers. What matters is the supports or the money or other matters. So I'm hoping that NACCW will be very smart in this process and engage with good, hard questions, challenging child care reform people. Their ideas are not good ideas, as Jim has pointed out, and we can use the research to point that out. But we really have to be very blunt and direct and focused in terms of this, because that can do a lot of damage to child care in South Africa before it's done. I'm done.
Thank you, Jim. We're noting your comment. Research is important, but yes, we know policymakers won't only look at that information. We're going to hand back to Jim. He wants to add some comments.
I really appreciate all the comments that have been made, and particularly the voices of those who lived through the various forms of care that we're talking about. I agree with Nick. Research alone will not change policymakers, but we have to challenge the statements that research has proven that all residential care is inherently harmful to children. That's simply not the case, and we have to make sure we challenge those statements. But the key is to get into a conversation, and I think the more young people who can be engaged in the conversation, particularly those who have experienced different forms of care, the better. Because I think Nick would probably agree that a compelling story or two from someone who's lived through various experiences can be very powerful. The only problem with it is it's anecdotal in the sense that you can find people who've had horrible experiences and find people who've had great experiences. And so those alone don't prove the point that we need to make, but their voices need to be heard.
Thanks. I see one more hand. I'm trying to see who that is. There's a hand with TE, Tanya.
Yes, good morning. Thank you. And James, I heard what you just said and what everybody's been saying. I totally agree with it. As a director of a child and youth care centre here in Port Elizabeth, we have proceeded to get each child in individually. There are 90 kids here at the moment between the ages of 3 and 20, and to ask them how they feel about being at this particular centre. Firstly, I'd like to say that despite the circumstances that they were removed out of, not one of the children here want to be here. Not one of them. They want to be at home. And that makes it exceptionally difficult when it comes to providing therapy and providing the developmental programs according to the IDPs, etc. And it's a sad state, that resistance that you have from the children, because they don't want to be here, despite the fact that they've been severely neglected, abused sexually, emotionally, physically, abandoned, etc., etc. And that is, I found, our biggest problem at the moment is, and when you've got the Department of Social Development coming around and saying to you, but I want to hear what the child has to say, which I totally agree with. Don't understand me incorrectly, but we're dealing with here resistant clients, if I can put it in that way, in the social work terminology. And it is exceptionally difficult to get the children then to participate and to cooperate, because what's happening is they're refusing to go to school. They are trying to get child and youth care workers fired by standing together and saying the child and youth care worker has hit me or sworn at me. And it is these internal struggles that we are sitting with at the moment. And then you have the external side of Department of Social Development coming in and ticking boxes. Yes, 100%. We have monitoring social workers coming in. Money has been spent on that, created a whole new section to do monitoring of child and youth care centres to make sure that, you know, we've got all the necessary documentation, etc., etc. So it is really hard in the child and youth care centre at the moment to try and render the service that we want to render with the participation of the children. And yes, I'm sorry, I don't even really know where I'm going at the moment, but child participation is essential. I totally agree with that, and that is what we are trying to do. And the type of questions, the answers that we get is, what do you need at the moment? The answer would be more sugar for porridge. And so it is, we're writing everything down. The feedback from the children is extremely negative, and we're trying to address everything. But I wanted to just say to you that my experience is that I've been here for 9 years now, and I've been in social work for more than 35 years. The children that are here don't want to be here. They want to be at home. We don't get the support from the external social workers, even for a weekend placement, never mind a holiday placement. So the reunification services are not taking place. We are providing food parcels for the children to go home for a short period of time. So yeah, we need to do something to change the situation, because if we're going to keep on asking the children, which we must do, If Department of Social Development comes in here and asks the children, they're going to say, we want to go home. It's a horrible place. It's a jail. We don't want to be here. We don't get the food that we want, etc., etc. So, yeah, I just wanted to give you a little bit of feedback on, from our side internally, what is happening here, and then trying to work with case managers who are not available, case managers that are missing in action, case managers that are not responding to emails, to telephone calls, to WhatsApps. It is this whole system at the moment that is letting the children down. And I'm really, really sad to say that. I believe that the children should be at home. But if there's no services rendered to the family and the circumstances at home is not improving, the children cannot go home. Anyway, that's my bit. Thank you very much for everything.
Thank you, Tanya. Before I go to the next two speakers, I just want to comment. I'm also a director of a child and youth care center, so I know where you're coming from. And I think we all share the same sentiment that when children are placed in residential care, there will be resistance because obviously they prefer to be at home for many reasons. Ideally, yes, we support the same intention that they should be at home. But like we are fully aware of in the context we work with, there are extremely many reasons why they cannot return home. And that does leave us in a space in residential care where we do have to find a fine balance between how do we support our children through the challenges they are facing, through the difficult transformation process that they're going through in being placed, and understanding that this placement has to be there for that particular time frame until such time that a home is suitable or, ready for them, family is ready for them to go return back. So I don't think any of your issues are solely yours. We all share that sentiment every now and again in residential care. Whenever children do not want to follow the rules, do not want the discipline and the routine, or are not happy for any other reason, they will throw behavioral tantrums, behavioral issues will come forward. And those type of comments are normal in residential where children will act out and say things like that. The question is, how do we respond to it? And that's the most important point, I think, is we must come together as a team. If you're not figuring out the answers within your own institution, you need the support of other institutions to guide you. That's the reason why we have NACCW, so that you have forums and you work with your forums to get more feedback and support on how do we strengthen what we're offering in residential care. How do you help the children that you're working with in residential care? So I think your conversation can be taken to support you with what you're trying to do and what you're trying to make in terms of a better space for your children in residential care. I'm going to go quickly and time is going to catch up with us. So I'm going to go through the hands that have been up. We'll start with Miss Cindy and then we're going to move on to Richard. We'll take those two first. Thanks.
Good morning, colleagues, and thank you, Madam Chair, for the opportunity. Now, Mike, I just have a question on when they talk about deinstitutionalizing the institution, are they also talking about the organization that are doing secure care programs, or is it only the ones that are working with the safety of the children in children's homes? Thank you.
Your question is noted. I don't have an answer for it. Maybe someone else will guide us on that. We'll move on to Richard.
Good morning, everyone.
Morning.
I'm Richard Mfuku. I used to work at the Secure Care Center for 12 years in the Northern Cape. The type of children we work with is currently sentenced children. And I think for myself, for the years, child and youth care workers are not enough to sentence children. And I think social development should bring more stakeholders in part, because there are no disciplinary measures that really can develop the children. Even with the programs, there are no such things. That's why the children will say, always cry and say they have just been locked up, because no program is the same. The secure care center is the same as a jail, because the children were sentenced there for 5 years, murders, rape, and all those, and there's nothing development for those time that I are there for them. May I thank you?
Thank you, Richard. Yeah, I think that's a whole different section as well that may be needing review as well in terms of what's happening in secure care. But thank you for your comments and noted. We're going to then move on to Mtantwa. I hope I'm saying your name right. Mtwana, and then Nonchlanchla.
Good morning, colleagues, and thank you very much for the opportunity. I am Michael Mtwana, the Child and Youth Care Supervisor as well in DR. I'm noting the two speakers that have spoke. I think they've touched few on my comments that I wanted to make. But what I wanted to come up with is that if then we saying that we need to institutionalize the residential settings. My concern as much as it's with children, do we have, or is there a plan perhaps that is there for the child and youth care workers or the institutions that are currently taking care of the children? I'm looking at the officials, the bulk of officials that are rendering this care. What will then happen to them? Are we saying then that the government must add on the unemployment rate that is currently high in South Africa? Because I think it's some of the issues that we need to look at when we deal with this matter. As much as our priority, it's our children at the moment, because I think we have a different view from other countries in terms of taking care of our children, looking at our social dynamics. I think my colleagues have elaborated on that. We have a different view in terms of cultural backgrounds and so on. I know that there are children that are benefiting out of these settings, children that today, some of them are child and youth care workers because they come out of these centers. So are we then saying that if we deinstitutionalize the settings, is that going to assist us as the country? Are we going to be able to build the children that have abusive background and so on? So for me personally, I really don't think that was going to assist the country as a whole, or even the setting of child and youth care as a whole. Thank you very much, ma'am.
Thank you. Nonchlanchla, next.
Good morning, everyone. I would like to believe that there's always a good and bad to every situation. I understand that maybe there's also issues about the institutionalization of children and stuff like those. But I feel that a lot of research needs to go to the children, the services that are already rendered, that are currently rendered in institutions. Because when you open a talk about this subject to people who are leading the process, they tell you otherwise, and they have a lot to say. So I believe that it's a good thing that we are talking about this, and the NACCW has opened this dialogue so that we are able to converse and talk about these issues and eventually get to a point where there are good decisions that are taken. But my point is that prevention strategies have not been explored. That is just my view. I feel like there's a lot that needs to be done in terms of prevention rather than focusing on deinstitutionalization, because we cannot do away with the fact that we will always have children needing care. And there will always be children that are abused who needs to be removed in those situations in their homes. And what then happens to those children? I think I will end there.
Thank you, Nanshlanch. I think your points are noted as well. We are reaching the end of this webinar, so I'm going to firstly maybe give Jim an opportunity to see if he has any final comments. Then we will move forward on the agenda.
Well, thank you, Fiona. I just want to say that this demonstrates how complex the issues are that we're talking about. And I think the NACCW starting the conversation is really important. We only touched on a number of the issues. There are a lot more that we could talk about, as you all know. So I just encourage the NACCW to continue to try and build the dialogue with the various groups involved. It's not an easy process. There are many different emotions and as well as funding and political issues that arise, which aren't always talked about. But if we can keep our eyes on the best interests of the child as we understand them and to engage with that as the focus, I think we have no choice but to keep doing that because the children need us to advocate on their behalf. I'm feeling a little tired now. It's getting on to 1 o'clock in the morning for me. So I think that's enough for today for me. Thank you.
Thank you so much, Nick. I think, Jim, we want to acknowledge that you have sacrificed these early mornings of the morning and evening, late night, to be part of this process. But I think you were a very important expert this morning for us. To give us a very insightful speaking, conversation around this, and your thoughts, thought-provoking things that we're going to take back and review everyone and be able to share and think a little bit more around the topic. With that said, then I'm going to move towards the closing remarks. We don't want to drag this any further. I think we've given people an opportunity to share, and we're very appreciative of all the international, national guests that have come through. We're grateful for your comments. And as we said, this is the start of all our conversations. And people are most welcome to continue to share and make comments. I think important to raise when we are going into this closing comments is to say we do acknowledge every single person's comments made here today. Residential care or any institutional care and all the other types of services we offer to children in any country is complex, and it comes with a whole lot of dynamics to understand and to work through. And as service providers providing services to the best of our ability, we do want to do the best. We do want to make sure that we are above board, that we're compliant, that we are doing what's supposed to be done. And with that said, I think we see this as an opportunity as much as when we first heard the word being drummed up louder and sudden focus on deinstitutionalization. We had a lot of calls. We had people saying we're scared. Is our jobs in jeopardy? Is our children going to leave the home? What's going to happen? People had fear set into them. And that's one of the stemming reasons why we wanted to start a conversation, because the more knowledge we have, the better it is for all of us to be equipped and empowered on this conversation. So wherever you are, you at least are able to respond appropriately by knowing more about what's going on in the sector. So we take this wonderful focus, although it came a bit negatively into light, for us as a beautiful opportunity for us to revisit and bring the focus back to residential care. As we know, there hasn't been a lot of focus on residential care in the recent years, and it's an opportunity for us to bring it back to residential care, revisit what we're doing, how we're doing it, and also take a proactive stance so that we can build our own portfolio, our own evidence, have all the lovely stories of our care leavers and recipients of the services that we offer, putting it all together so that we create our own portfolio. We have evidence at some point that is going to take us forward to value and strengthen our fight around saying and putting forward the thinking that residential care is a significant and important part of what we offer in the spectrum of care. So I think that being said, what we would like to see happen come out of here before I conclude is that we would like to obviously open up and say we are introducing or would like to put a resolution forward that there is a national task team that comes out of this. And if there are interested persons who want to be included in that task team, who continue this conversation, looking at how we're going to advocate better, how we're going to take the dialogues further, how we're going to look into strengthening the research better, and have the further conversations with the recipients, all of that, bringing it together after we put everything on paper. We would like to take it forward with the task team and say, let's move forward. Let's take whatever's come out of this conversations today, put it into action plans and work around it. So in the next few months, we can come back and say, let's review and see what's happened and where we've gone in terms of this conversation as well. So I want to leave it there and leave it open to saying we are wanting to consider that task team, and we would gladly accept interested persons, like-minded persons with expertise who want to join us in this conversation to take it further. With that said, I'm going to hand over then to Donald, who will take us through the final closing comments and a vote of thanks. Once again, thank you to everyone for staying on, for being part of this conversation. We reached over 130 people, which means it's a lot more stronger because there are watch parties throughout who have joined for today, emphasizing the importance of this conversation today as a start. And we will definitely want to keep this conversation going as we move forward. So thank you, everyone. And thank you especially to James for being part of this morning's presentation, sharing and coming forward to give your input, and to all our other speakers, and to Anna for also being present to support what we are doing in South Africa. Thank you. And I'll hand over to Donald.
Thank you very much, Fiona. I'm not sure if Zeni, you want to say anything with regard to the task team and how we get volunteers on that.
Yes, I think that Fiona has put it out, that we believe that this is an important debate that requires a variety of voices coming together, because I think we do need to have a position from the NACCW based, and we can decide, but I think guided also by the international statement and perspective about where do we stand, and we need to do the appropriate advocacy. I just want to make a last comment, that listening to Fiona at the beginning when she talked about the history and basically the context of South Africa's debate around it, the many issues that have come out on the different documents, the current debate, and the fact that NACCW has engaged in the history of commitment to a continuum of care. We piloted the Izibindi project. We indicated our commitment to community care, to foster care, to secure care, to a variety of diverse child and youth care options aligned to the alternate care options that Jim mentioned as he presented the international perspective. We show our commitment to transformation of child and youth care services to children, recognizing that residential care is a critical component and should not be sidelined in any debate. I just want to emphasize that the points by Dr. Anna Smith on quality care came out in some of the comments that were made as well. We need to be assured that when we talk about the value of residential care for children and highlight it as we've done through the voices of children, we equally make sure that we are committed as NACCW to see that there is quality care offered to children, that children's voices are heard, that they participate fully in the process, and the best interest of children is considered as we provide individualized services to diversified programs. So I think I've tried to just pick up some of the perspectives that were raised, and I think there's a lot of work for us to do. So going back to your point, Donald, people are already, I see CYC Net has committed to be part of the ongoing engagement. There might be other key individuals. We seem to have international people. We've got experts from within the country, and we've got our child and youth care sector here. So if people are interested, they could provide a direct direct information on the chat box or directly to you, Donald or Fiona, that they would like to be part of a task team. And then we will actually convene a meeting where we look at the feedback from this webinar and plot a way forward for us designing the NACCW's position on this deinstitutionalization topic. Thank you. Thank you, Donald.
Thank you very much, Zeni. And mine is to thank everybody who has made the time to attend this webinar. Jim, thank you so much. We understand that it's midnight or early morning in Canada now. And thank you very much for giving us your time and sacrificing your sleep. And to Fiona, thank you so much for the opening statement and for the entire program direction. I think that our discussions have moved from just ideas and thoughts and plans. Now we have started this process. Thanks to Anna. Thank you very much, Anna, the president of FICE International, for your input. And Conrad, and we are very happy that you were able to join us. And Christina, thank you so much Christina from Sweden. Thank you so much for joining us. We have had the voices of the Youth Forum members who are former beneficiaries of the child and youth care programs. We very much appreciate your input and sharing with us your experience in the child and youth care from the Child and Youth Care Center. I saw we had Zambia represented. We had CYC net represented by Martin. We have Professor Nick Smeyer, members of the NACCW National Executive Committee, and Julie Todd, Elwin Gallant, the former chairperson of the NACCW. I saw Micah, I saw Chantel Jonker, Simon Peter from Kenya, and we are impressed that this webinar has attracted so many people. We also recognize that we've got many people who are sitting in watch parties. So the number that we have here is just over 100 can be multiplied by 3. So seeing that we've got over 250 people who have joined this webinar, it's exciting. And as indicated by Fiona, we are going to make sure that we continue this process. The task team that it's going to be put together will ensure that we keep you updated of the developments and also to get your thoughts as to how we are moving with the process. Please do remember to to write your name on the chat box if you would like to be a member of this task team. With all of that, I would want to wish everybody from wherever you are, if we are sharing the time, enjoy the rest of the day. And if it is night where you are, enjoy the night, have a good sleep if you are going to sleep. Otherwise, the meeting is now closed. Thank you so much.
Thank you, Donald. Thank you, Zeni. Thank you to everybody for being here and for staying through the entire session. We look forward to further debates and we close the meeting. Thank you, Jim. We can send you off to bed now.
Thank you, Jim.
Take care. Bye.